Welcome to the Optimize podcast from Prescribe Fit, where we explore the intersection of orthopedics, lifestyle health, and virtual care strategies to optimize patient outcomes and private practice success. Join us to hear from industry experts as we dive into the tools, technologies, and approaches shaping the future of orthopedic care.
Hi, listeners. Welcome to the Optimize podcast. I'm your host, Brock Leonti. This podcast is for clinicians, physicians, industry, and orthopedic and healthcare professionals. Today, we're recording from my hotel room in San Diego, California, at the American Academy of Orthopedic Surgeons, the AOS 2025 conference. I'd say welcome to sunny California, but it's 6 a.m. here, and we're within an hour of sunrise. So I'm joined today by Dave Zauha, Executive Director of the Nebraska Spine and Pain Center, as he shares his journey from financial services to healthcare administration and the leadership principles that drive his success. We're going to learn more about how he explores his critical role of telemedicine, patient education, and the digital resources enhancing patient experience in differentiating private practices. We'll also discuss ancillary services and ensuring financial stability and strategies for balancing business growth with high quality care and the future of spine and pain management in an evolving healthcare landscape. Dave, welcome.
Thanks, Brock.
Would you mind giving us some background on yourself for the listener?
Yeah, sure. It's been an interesting ride for me in practice management and just getting into my position where I'm at now. I actually grew up on a farm in central Nebraska and got a business degree from the University of Nebraska-Lincoln, and then went back and farmed for 10 years before randomly getting into managing a small family practice office in Lexington. And then I met my wife, and that led me to Omaha, where I actually managed a payroll company for a couple of years before getting back into practice management with an orthopedic group. Was there 17 years, went through a merger and a rebrand, then left there and merged two other orthopedic groups in a nearby town before having this opportunity to join Nebraska Spine and Pain Center in Omaha, and super excited to be here.
That's great. So just going back, what did you farm out of curiosity?
Yeah. So we had hogs and row crop corn and some alfalfa.
Oh, very good. Okay. All right. That's great. So when you started your career in the financial services industry, what inspired you to pursue a career in healthcare administration? How did you lead down that path to your current role here at Spine and Pain?
It was really random. I've always been intrigued by business, finance, numbers, and very entrepreneurial at heart. But I didn't even know practice management was a thing when I was in school. When I was farming, I actually was on the school board in Lexington. And one of the other school board members was a family practice doc. When I was looking to get out of farming, he said, "Hey, we're in need of a practice manager. Would you be interested?" I said, "I have no knowledge of what to do." And he's like, "I know you're a good person. I know you understand numbers. I think you can do this." And so really random entry. There's a lot of folks that go out and get an MHA. Their whole future is planned around getting into medical management. I had no clue that it was even a job.
Yeah. How interesting. Yeah. My mother, fun fact, was on the school board too. So there's just this automatic respect for someone who leads us on the school board, I feel like. So that makes a lot of sense.
One of those great unpaid sacrifices for sure. Yeah.
There you go. Yep. That's right. So when you look at that, speaking of good people making good decisions, what core values are at the crux of your leadership, guide your leadership and your philosophy, and how do you instill them in your organizational culture there?
Oh, I really like that. At the heart of everything is people. And one of my core values is really servant leadership. I really try to let our folks know that every job is everyone's job. Everything is so important and needs done, from taking out the trash to signing someone up for surgery. Not all of us can be surgeons, but all of us are needed by the surgeons to make sure the patients get seen, that our staff are happy and cared for. Because in the end, if you have a happy team, the patients are going to feel that, they're going to sense that. And so it really starts with the people. The flip side of that is, and really what the other piece that I enjoy, as I said, I'm very entrepreneurial at heart, is just managing efficiency and value. And so you can't cut your way to savings, but you do have to be cognizant of what you're spending money on, how you're spending it, and getting the most value out of that. That's super important.
Yeah, and I think we think of healthcare as something that's there and sustainable through reimbursements, but at the end of the day, we have to remember it is a business. You have to run it as such, and that's what makes the healthcare organizations, from a financial perspective, different from those that are run and not really cost conscious there.
Totally. It's when you talk about reimbursements, there was an interesting graph that I saw recently, and it showed how Medicare reimbursements to physicians have basically flatlined over the last 10 to 20 years. And when you look at comparison to inflation's been going up 4 to 5%, and physician reimbursement from Medicare is flat, hospital reimbursement's been going up, and they have good ways of getting those reimbursements for themselves, but the physician lobby is just not strong enough to have an impact on that.
Yeah, definitely a different advocacy group there and focus on that. So looking at your career, reflecting back on that, what advice would you offer to emerging leaders in healthcare administration?
It's a long term, it's a marathon. And so too often we get wrapped up in the day to day and really focusing on, I've got to make an impact now. But it is amazing to look back. I've been in orthopedic practice management for almost 25 years. And as you look back, you really see that over the long term, as I said earlier, it's really about the people and the relationships. And if you concentrate on that and creating a great team and developing that team, and when I say developing, it's helping them to be better leaders. And in the end, I want to keep all of our team on staff and would love them to be here for long term. But I also want them to be happy and to grow their abilities as well, practice at the top of their scope. And if I can grow their scope, that's all the better. And so it's really just looking at that long term and looking at your people.
Yeah, great empathetic statement there as a leader. So you can definitely show that your servant leadership comes out there and shows. Yeah. So today's unique and personal question. So each time I'll be asking a unique question that exercises opinion, but it's rooted in some sort of fact. And usually it's related to lifestyle health because we're talking about patient optimization and success. So today's question for you. So if you had to choose between cutting sugar or cutting alcohol from your diet forever, that's a big word, right? Which would you pick?
I would cut alcohol. It's terrible to say, but I run so I can eat cookies. And so it'd be hard for me to cut out sugar. I don't know what it is. I know that sugar is not great for you, but boy, after a lunch, it's sure nice to have a little piece of chocolate.
There you go. That's right. Yeah. It depends on whether the fun answer may be cutting sugar, but you're right. The better and more healthy answer is cutting alcohol. Essentially, it just has no essential value. It drops or disrupts metabolism, liver function, and all of that. And while sugar is not great in excess, it does have some sort of value to you. It's a carbohydrate, it's a quick energy source, those kind of things. So added sugar aren't great, but some sugar is all right.
I like a Snickers now and then.
There you go. Yeah. Yeah. That's great. So let's turn to some topics in telemedicine and technological advances here. So I see a lot of patient resources, spine education, and information about preventive care on your website, social media. Why do you think it's an important piece of the patient experience?
So one of the things, and just to kind of wrap Nebraska Spine and Pain Center, one of the big benefits that we offer in terms of spine, back, pain care is that we really can cover the continuum. And so if a patient comes to us with back pain, we're able to see them. We have APPs that can get them in quick and diagnose what might be hurting. We have MRI and CT on site, so we're able to say a patient's driving a couple hours to come see us. They don't have to come back later to get that exam. It's a necessary evil that so much of the back and spine, the muscle, the nerves, it takes an MRI or CT to really diagnose what's going on. So many times physical therapy is a key part. A lot of prior authorizations require conservative care. And so we have 8 spine trained physical therapists that they really know back and spine care. So a lot of times in one session, diagnose from a patient that, boy, more PT is not going to help you, but you need to get in and see the pain physician. And we have PM&R docs that do our pain side, or the surgeons that they probably have something that's going to need surgical care. Our physicians also are integrated with a specialty hospital. And so I just think that continuum of care really provides a lot of value to the patient and really gives a specialized care to the patient, where they're not seeing a general physician at the start. They're seeing somebody that understands back, spine, pain care from the get-go until they're done with therapy after surgery.
Yeah, a lot of times the patient experience the journey that they take, whether it's based on the guideline treatments, but if outside of that, it's a hard journey, right, for the patient. They might go see one doctor as a generalist, and then they're seeing a specialist, and then they're getting imaging. And so you're ping-ponged around as a patient.
Oh, yeah.
And so that definitely helps to get just right to the point and get to see the person that you need to see there from that patient experience side. So do you think with that education out there and informing patients, that helps to attract new patients to your practice?
That's our hope. Is that interesting stat that came out, like 65% of patients go online to find their medical care. And so if we have good information, whether it's on Instagram, Facebook, our website, that helps promote and provide patients education where they can do their own research. And if they can find that information on our side, or we're able to lead them to some of that information, as we've talked, it's just so important to create knowledge and really help patients find the best care. You don't want them to necessarily self-diagnose, but providing them an opportunity that is a doorway into our practice would be great. We do have a lot of patients that come from a long distance. And so, as you had said, we do offer telehealth. It's unfortunate that this is a great way for patients to be evaluated, but it's unfortunate that I've heard insurance companies are actually looking at not paying for telehealth and moving away from that. And I think that this is such a great tool for medicine, because when you think about it, physicians are super busy. They have to be super busy. As we said, Medicare reimbursements have gone down, so you got to see more patients, unfortunately. Pay the bills. And so for you to come in and sit in our waiting room for an hour to see the physician for 10 or 15 minutes is not a good use of your time. And so a telehealth visit, you can be queued up, you can still be working. There are instances where you still need a physical evaluation sometimes, but boy, if you can get that initial or a follow-up with the telehealth, that's a great opportunity.
Yeah, I would agree. Not only being in the digital health industry myself, but just looking at it from a patient standpoint. There's a lot of times where you call on your physician and they'll say, okay, come in for this. And you're like, you know what? I mean, in a general sense, it's just a cough. Like all I need is some sort of medication, or I know what I need from an orthopedic standpoint, or maybe the provider can just say, hey, here's what this patient needs. So that really cuts back on the costs,
Totally.
on the excess time we spend traveling to, taking time off work to go to visits. And then from the provider side, you get the impact of, I can care for my patients when they need it most. They don't have to wait a month to come to a visit or drive 2 hours to come, or I don't have to do that within my practice here. And I can do this over technology. That's the way the world's advancing, but it almost seems like healthcare lags.
It's healthcare is so far behind technology wise. And we were talking a little earlier, it's so shown just in how insurance works. Insurance treats the ailment after you're already sick, as opposed to insurance trying to keep you healthy before you ever have to get sick.
That's right.
This seems backwards.
It does. I agree. Well, I guess we are in positions that we can help to change that in some way.
And that's Prescribe Fit is one of those great tools to try and keep you healthy or get you healthy. As you can imagine, some of our patients come in and they hurt so bad that they're out of shape. And when folks get above a BMI of 40, they're not as great a candidate to do surgery on. There's just a lot of more comorbidities and risks with doing a surgery with somebody that heavy. And so having a tool like Prescribe Fit that enables patients to lose some weight ahead of time, those are things that we like. It tags in along with the physical therapy and the continuum of ancillaries that we offer our patients to help them get well.
Yeah, that's great. All right. So speaking of that, let's switch to ancillary services. Private practice, you're looking at different ways that you can help treat the patient. Like you said, the hospital systems, they have all of these services that are within their umbrella.
Yeah.
The private practice is trying to operate. They're trying to just do daily business and keep patients within, keep the patient experience and the journey right. So they also have declining reimbursements. You mentioned that. So how important are ancillary services to the long-term sustainability of a private practice?
I don't know how you can do it without ancillary services as time goes on. And it's, again, as we talked about early on, it's about the people. And so when you think about the patient and trying to make it easy for them, I know there's folks that would say that it's a money grab, but it really isn't. There's not a ton of income that necessarily comes from ancillary services, but everything helps a little bit, if that makes sense. And if you're able to save the patient time so that they can come in, our physicians and physical therapy and MRI are all right in one building. And so if the patient is in seeing a physician and the physician's like, I really need an MRI to determine what's going on, let me see if I can get you in today. Then you don't have to make another trip back. You walk down, get into our MRI, half hour later, you're done. We get the read in an hour and the doctor's able to determine what's going on. Same goes with physical therapy. If our physician's like, I'd really like you to see one of our therapists, let me see if I can get you over to see them and get some exercises or get you fitted. We have bracing. Let me get you into a back brace and let's see if that will help with your treatment. As we were talking about telehealth, it's so much conservative care has to be done before you get to surgery that having the opportunity to get the patient into that conservative care quicker just gets them further along their treatment path faster, because in the end, we want them to get back to a productive life and away from their pain as fast as possible.
Absolutely. Yeah. And you're operating there just as an entity that needs to offer the same things as the health system does too. So that vertical integration of all those services is definitely something that, hey, if you need these things, why not do them under your roof? It makes a lot of sense from just a logical perspective, but then also from a financial perspective,
right?
It keeps it under your thing, just as a health system would consider for their services as well.
Yeah. And the physicians are able to collaborate with all of the employees that are involved along with that care treatment plan too.
Sure.
They're right there. They can go talk to them.
Right. Just like go down the hallway, like we used to talk about before remote work. Let's go down the hallway, knock on the door and have a conversation. But yeah, absolutely. That's great, Dave. So when you look at this, what are some of the most valuable ancillary services that you have put in that offer financial stability, that improve outcomes? What would you say are there for you?
They're all important and they're all necessary. I think as we were going through, one of the pieces we were missing was really that wellness piece, to get people healthy, to keep people healthy. Even though we're a surgeon group, the last thing that they want to do is have to do surgery. If we can heal someone without during surgery, that is the optimum. And so looking at that continuum, a piece that we were missing was really a wellness piece, and Prescribe Fit has fit into that well. We're going to be able to offer our patients an opportunity to get healthy on their own, or in the case of needing to do surgery, to try and help them lose weight. You've got, again, the telehealth, the physical therapy, the pain management, CT, MRI. Worst case scenario, we've got the specialty hospital where the staff that are working there, everything is geared towards the spine surgery. And so it's just having people that understand completely what the patient needs and what that care looks like is so key to the total treatment and follow-up.
Hmm. And how do you go about selecting someone, a vendor partner or a device rep, someone that, you're looking at when you've put in these ancillary services? What kind of criteria do you look at there?
Well, so there's several factors. Of course, cost has always got to be important, but it's really a value proposition. And so take bracing. When we look at a bracing partner, we're looking at the product. How does the brace fit? How does it function? What is the vendor like to work with? So
Okay.
if the vendor is super easy to work with and listens to our needs. We want it to be a dialogue. Again, we want something that is going to benefit our patients, but also be easy for our employees to work with. We have a defective product. We don't want to go through a lot of rigmarole to get a return. It's like, hey, this is defective. Okay, send it back. We'll get you a new one. Just those kinds of things. So
Yep.
It's really a value proposition. And what is the value to us as a business? What's the value to the patient as the end user? What's the value to our staff as someone that's having to work with it day in, day out? And so sometimes you may pay a little more to get a higher quality product or a better service, but it all has to work together. And so that's really the process we go through when we're looking at vendors.
Yeah, that's great. That's great. And so when you look at technology, telemedicine, these things that we've talked about, remote patient monitoring, how do you see that, or how do you envision that evolving in spine and pain management over the years to come?
Yeah, that's a great question. We're actually looking a lot at technology right now. And as you had pointed out earlier, healthcare is so far behind. I can't tell you how many faxes we still send. And the rest of the world has moved on to scanning and emailing documents, secure document transfer. We're still faxing documents. It just blows me away. But how can we, again, make our jobs more efficient? One of the things that is most painful are prior authorizations. And as much as I would love insurance companies to do retrospective instead of prospective prior auths, it's one of those things that they have almost made it these hoops you got to jump through. And there's certain things that you have to document, which conservative care is one of the main things. And there's companies out there that are doing this, EMRs that are doing it, but finding ways to automate prior authorizations, to automate patient intake, appointment scheduling. All of those are things that we're looking at. And AI is a great tool. It's even developing for documentation. And so those are things we're looking at still. I don't know if it's infancy, but it's definitely not totally developed. And so those are things we're looking at, again, to try and create value and efficiency for our staff.
Yeah, that's great. And so those, would you say, represent trends, innovations, things that you're preparing for to adapt with as the landscape changes and new products come available to you?
For sure.
Yeah, that's great. That's great. AI, what an interesting tool. The data really shows that Americans are not ready yet to be cared for by an AI bot or an AI persona. It's not going to go replace Dr. Smith down the hallway, but certainly the experience to get to Dr. Smith or to evaluate different parts of their healthcare and their health up to that point where the doctor takes over. There's a lot of evidence showing how effective it is to put in place right now.
Right. Well, you can imagine that the things that are very repetitive, like patient intake.
Yeah.
Provide me your insurance, sign the HIPAA, pay your bill, even intake into the room where you're asking how you're feeling, what hurts, height, weight, blood pressure. Those are things that you could foresee at some point that is almost like a robot that is able to take that. Now, the true physical exam, you probably do need a person that has been through it, understands the anatomy and things like that. But a lot of the things that are very repetitive and rote, those are things that you can foresee at some point could almost be handled by, I don't know, you hate to say a robot, but that's the idea. Yeah.
A smart computer.
Exactly. Exactly.
Absolutely. That's great. So Dave, we have a signature question that we ask. We ask another question, but that differs every time. This is the same question for every guest.
Yeah.
So if you could give every patient one superpower or piece of advice to optimize their health and transform their life, what would it be?
Exercise.
Exercise.
It
Why
is. We as a society have just gotten so, what's the word? I don't want to say complacent, but we just sit a lot. I saw an interesting stat yesterday that said people on average in like 2023 spent 7.5 hours on a device, TV, phone, computer. And so it actually surpassed the amount of time people are sleeping.
Wow.
I know. Isn't that crazy?
Yeah. And it probably makes you sleep worse too, because you
I know.
sit there and flicking through on Instagram or TikTok. And
Yeah, what it does to us. And so we've just gotten, I don't know, lazy, I guess is the right word. We sit too much. And I think when you look at the stats of obesity in America, 75% of folks could be classified as obese. And that's a staggering number and is very indicative of our healthcare or healthiness. And so I think people just need to get up and get moving. And it's amazing what walking, getting 10,000 steps a day and what that will do to loosen up your joints and make you feel better.
Well, what a couple common misconceptions are that if I'm in pain, I shouldn't move.
Right.
And I should just be sitting there. Oh, makes it far worse. Far worse.
Yeah.
And they say that sitting is the new smoking now.
That's so true.
We've reduced down on our tobacco intake, but we've increased on just being sitting there on the couch. So
yeah. I know. Even a stand-up desk helps a little bit, right?
It does. Yeah. Absolutely. Anything else that you'd like to discuss today? Anything else that you feel like we've missed, or a question I should have asked you? Or
No, I love what I do. It's such a unique position. I compare it to an hourglass where you've got the physicians above and the staff below. And I work best when the information flows through there. Pluses and minuses, it kind of puts you on an island. And so having folks, counterparts, administrators in other offices really helps having somebody to talk to. But the beauty is every day is a new day. There's always something new and interesting that comes up. Getting to know people, looking at the finances, dealing with vendors. Maybe you're working on benefits. So for me, the job is fantastic because of the variety and just the impact that you can have across so many different knowledge bases. It really makes it fun.
That's great. Yeah. Hourglass. That's a great analogy right there.
Yeah.
So Dave, where can listeners find you if they want to get a hold of you? Where's the best way?
You bet. Probably email is the best way to get me. Super easy. Yeah. It's Zauha, Zauha @nespine.com.
Okay. Excellent.
Yeah. So would love to hear from folks. Always happy to connect. I think the world is too short on collaboration. There's lots of orthopedic groups. We all compete, but there's a lot of patients out there too. And we can all grow and learn. My big thing is let's keep private practice private. Too many folks have become employed by hospitals, private equity, different things that take away that entrepreneurial spirit.
David, you mentioned collaboration. Tell me a little bit about what you do to enhance that and to collaborate with folks that are in the same industry as you.
Yeah. So meeting people is just so much fun. Everybody has such a unique perspective on how they do things, how they see things. And so just a variety of ways. We actually have some local administrators that get together, have coffee and rolls. We'll bounce ideas, things that are going on. A lot of times we're just talking about family and what's going on. You bring in, hey, we're going through looking at benefits, or what vendor are you using for this or that? I can remember recently some of the questions were, hey, what are you using for a cleaning service? It's hard to find cleaning service or laundry services. But then you get to the national level and you have the orthopedic administrators, AAOE, you've got Ortho Forum, which is a group of large private practice orthopedic groups that get together. And you just learn so much from all these folks and how they've done things, how they've grown personally as well as professionally. And so one of the things about Ortho Forum is that it's physicians and administrators together. That dynamic is so unique and brings two different thought perspectives in. And so getting that all in one room is super exciting. And just sitting down at dinners and just talking and meeting new people. And it's like, hey, tell me your story. How did you get in? And I've got a unique story, but everybody has a unique story. Everybody's driven by something different. What drives me? What books I'm reading? What am I doing to impact the value proposition? Those are all fun things and questions to ask. And so the collaboration side just makes us better as a person, as a leader, and as a business. And so I love that.
That's great. Yeah. And like you said, so you're operating all as unique people under your unique practices, different sizes, different focuses. There's spine and pain. Some are orthopedic, some are total, some are sports med, right? And so and even all under the same practice at some points. But at the end of the day, what you're trying to do is operate efficiently underneath pretty much the same reimbursement codes, right? The same CPT codes that you're billing. Everything all just comes up to the top where, you're getting funded by those sources. You have to be able to utilize the resources in a way that's effective for the patients and the outcomes, your staff, happiness, a triple aim quadruple now of Medicare, right? With no burnout. And that requires some collaboration, that you get information from all those sources that you can utilize to help enhance what you're doing in your own way.
Yeah, totally. One of the big sessions at AAOE and Ortho Forum is networking. And it's networking by group size, networking by project. And so you get people that are working on similar things or in a similar size group, and you're able to really connect and get folks that you can go to for questions. Yeah, it's just being able to collaborate with folks. Life is too short to not have some friends that you can rely on.
There you go. And hopefully have a little fun doing it too.
Hey, always.
You're right. Life is too short. Absolutely. Yep, you're absolutely right. I agree with that. I think that you have a great message. You've had a great career, and thank you for being on the podcast today. So
yeah, this is super.
Yeah, excellent. So that's a wrap for today's episode of Optimized, where we empower providers to enhance patient care. We appreciate you joining us as we explore the innovative ways to improve patient outcomes through lifestyle health. If you found today's discussion valuable, please be sure to subscribe, share this with your colleagues, leave a review. It all helps us to deliver the content that supports you and your practice. Thank you very much.
Thanks, Brock. This was great.
Thank you.
Thank you for listening to this optimized podcast episode from Prescribe Fit. Make sure you never miss an episode by following the Optimized podcast in Apple Podcasts, Spotify, or wherever you listen. If there are any topics or guests you'd like to hear on our show, email your suggestions to optimized@prescribefit.com. And to learn more about Prescribe Fit's virtual lifestyle coaching and remote patient monitoring program, visit prescribefit.com.